Okay, so blue refers to deoxygenated, red refers to oxygenated, but in the real life, you know, these veins aren't blue and red. That just helps us to learn. So let's start at the heart. We're at the left side of the patient, left ventricle. So oxygenated blood is going to be pumped through the ascending aorta, and there's three branches. The first is going to be brachiocephalic, because brachii means arm, and indeed it goes into the arm. Cephalic means head, and part of it goes into the head. So we call it the brachiocephalic trunk because it's going to branch into two smaller blood vessels. Here, we might as well track it. So here's the right subclavian, and it's kind of like a street. You know, sometimes a street gets different names, even though it's the same street, like Sylvan and Stanford. So here we have the subclavian. It gets near the armpit. We're going to call it the axillary. And then it gets near the arm. We're going to call it brachial. And it's going to branch. If it's on the ulnar side, where the ulna is, then that's the ulnar. If it's on the side of the radius, it's the radial, and it goes into the palmar arch. And then it returns via the veins. And many of these veins have the same names as the arteries. Not all of them, but the parallel blood vessels often get the same name. All right, so we were going up through the ascending aorta. The middle branch is going to be the left carotid, common carotid, going up into the brain. And then we have the left subclavian. Sub means under, clavian means clavicle. So under the clavicle, and it's pretty much the same thing here. We're going to go axillary and brachial. Here we have the jugular that's draining the brain. It's a large blood vessel. You can always tell on a cadaver, these are going to be kind of squashed, and on a cadaver, the artery is going to be rounded. Okay, if we follow the aorta, it's going to go behind the heart, and now we call it the thoracic, and then the abdominal aorta. And then here's a real busy area, because we're going to have a branch going to the hepatic, which means liver. So here's the hepatic. Then we have the celiac. The celiac is going to branch and go into the spleen or splenic artery here, and the gastric artery that we can't see, because the stomach's right here. We have the renal artery and vein, so artery going to the kidney, renal refers to kidney. And continuing down the abdominal aorta, it's going to branch, and it's going to branch real quickly here. There's an internal iliac and an external iliac. And then this short area is called common iliac, because when we use the word common, it's like shared. So this iliac artery is going to be shared by the internal and external iliac. And as we descend to the femur, okay, this is the big bone in the thigh, then we call this the femoral artery. And if it goes behind the tibia, we call it the fibular, because that's the fibula bone. It doesn't really show up here. And into the dorsal artery of the foot, or dorsalis pedis, the top of the foot where you can take a pulse. Here's the knee, or popliteal region. We got it.